Hi, my name is Matthew Brain. I'm a student paramedic at Monash. The date today is Thursday, the 26th of September 2013. I'm here to demonstrate in this video the various airway skills that we've learnt, such as placing a patient in a lateral position, how the triple airway manoeuvre differs from the sniffing morning air position, safe insertion of an oropharyngeal airway and a nasopharyngeal airway, laryngoscopy, and ventilations using a BVM device. Putting patient in a lateral position, you can only do this if you're sure that they do not have a spinal injury. Kneel at the patient's hips, bring the near leg forward, make sure their far arms are angled with their shoulder, move their near arm across, grab at the shoulder and the hips, and roll. Make sure, bring their knee up to their head at a right angle, bring their near arm underneath well close to their head, make sure you rotate their head. This prevents obstruction of the tongue into the oropharynx. Also make sure that when you're doing it you remove all items in the pockets, because this is a common cause for needle stick injuries. Triple airway manoeuvre and how it differs from the sniffing morning air position. First of all, the head tilt. Place your thumb on the forehead and your fingers like that and tilt it back, and then the chin lift is next. First of all, the head tilts to ensure that you've got the best possible head position and a clear airway for the next two moves in the triple airway manoeuvre. The chin lift ensures that the tongue's not falling back into the oropharynx and blocking it. These two methods make the sniffing morning air position. There's a third one called the jaw thrust, which is where you put your thumbs on the mandible and the fingers on your fingers on the angle of the mandible, and you pull back with the thumbs to ensure that the chin lift position is maintained. And the triple airway manoeuvre keeps going. Also, make sure that many people hyperextend the airway when you're doing it, so make sure you've got a towel underneath for an adult, no towel for a paediatric, or a towel under the shoulders of an infant, because this could lead to flattening out the airway, which is undesirable. Next. Safe insertion of the oropharyngeal airway. You measure from the lips to the angle of the jaw. Once there, you must make sure they don't have trismus or an intact gag reflex. Just put it in backwards until you feel the tongue, then flick 180 degrees and put in there. This allows for better oxygenation and the tongue not to obstruct the oropharynx. A common error is people don't put it in properly and they just push the tongue back, or they don't hold the tongue in place, so this can cause an obstruction. Nasopharyngeal airway, you measure it from the nose to the earlobe, that's okay, and then you insert it, rotating it at 45-degree angles, clockwise and anti-clockwise. If you feel any blockage, pull out and try the other nostril. Once it's in all the way, it can sometimes cause nosebleeds. Make sure you're maintaining the triple airway position. Also, a common error is when a patient has had brain trauma. You can't use it on them because there's a risk of introducing the nasopharyngeal airway to the brain. Laryngoscopy. It allows for the best visualisation of any foreign bodies that may be in the airway. You have to make sure the patient's unconscious and their gag reflex is not intact, because this could induce vomiting. Placing the left hand, make sure you maintain the triple airway position and start extremely right. Make sure the jaw is thrust forward and then push down until you feel the vallecular groove, which should just be below the tongue. And if you're doing it right, you should be able to visualise the vocal cords. A common error is some people do it too hard and they can smash teeth, and this can further occlude the airway. Ventilations using a BVM provides oxygenation and ventilation to the patient, one of the most important airway manoeuvres, and it can reduce the urgency of other techniques. Firstly, make sure that you've got a good grip, so thumb and forefinger should be around the mask, with the other 3 fingers just below the jaw or the chin. A common error is when the mask is not sealed properly. This defeats the purpose of it basically. So make sure your fingers are around it properly, and it should be at 12 breaths per minute. You have to monitor the chest and abdomen region to make sure there's no stomach inflation.